Hello, my name's Simon Brown. I'm the Guidelines Lead for JRCALC and Assistant Medical Director at South Central Ambulance Service. Welcome to this short video presentation for the JRCALC Clinical Update 225, the second release for 2025. I'll give you an overview of the updates that have been introduced in the latest release and also point you to further video presentations that go into more detail on some of the bigger updates that have been completed. Cardiac arrhythmia and sudden cardiac death has been revised and updated with a new section on sudden cardiac death. We've revised the bradycardia algorithm, which now includes the consideration of adrenaline for bradycardia that's unresponsive to atropine. So if a patient improves after a dose of atropine, then further doses can be given. But if there's no response to atropine, switch to trying a small dose of adrenaline 1 in 10,000 intravenously. Consider giving 50 microgram bolus, that's 0.5 or half a mil of 1 in 10,000 adrenaline for bradycardia with life-threatening symptoms such as hypotension with a systolic pressure of less than 90 millimeters of mercury. We've also included a new appendix on common cardiac arrhythmias, along with example ECGs, and for each arrhythmia, the treatment pathways are described for you to follow. Pain management in adults and children was previously 2 separate guidelines, one for adults, one for children. It's now unified in a fully revised and updated guideline. It includes specific guidance for different age groups and includes visual aids and specific aids, pain scoring scales such as PAINAD for patients with cognitive impairment such as dementia or learning disabilities. All these charts give a score from 0 to 10, which can then be entered if you require a digital pain score. There's a revised treatment section with an improved table on pre-hospital analgesia. For each drug, it gives the time of onset of action, time to maximal effect, and duration of action. Non-pharmacological treatments, which can be used to aid pain relief and reduce the perception of pain, has been expanded on. Vascular emergencies has been fully revised with a new section entitled Other Vascular Bleed Considerations. This follows consideration of a coroner's preventing future deaths report around post-operative bleeds from healing surgical wounds, where a brief herald bleed may appear trivial but can be the forerunner to a catastrophic bleed that occurs later. This is particularly where surgery has been to or near large blood vessels, such as the carotid artery or the femoral vessels. So if there's a post-operative surgical wound that's had a little bleed, just think of the location of this. If it's near a large vessel, then further assessment should take place. Altered level of consciousness has been revised. We had the term coma in there for reduced level of consciousness, but following feedback, we've removed the word coma and throughout the guideline refer to this as reduced level of consciousness. So any decrease in the GCS can be used rather than them needing a low GCS and to be considered in a coma. There's also a new section on sudden cardiac death. This is because a transient loss of consciousness may be an indication that someone is at risk of sudden cardiac death in the future. So these patients may need further investigation. Clear guidance is also provided on the requirements for the patient to contact the DVLA following a transient loss of consciousness, and it varies for car drivers and HGV drivers, so the class 2 requirements are also included. We've produced some other video presentations on the 225 update, so please listen to these. I'd like to thank all the paramedics, clinicians, pharmacists, midwives and many more who've taken up their time to contribute to these updates. As ever, we're always keen to hear feedback, so please do get in touch. On the front page of the JRCALC app, if you scroll to the bottom, there's a link to provide us with feedback. Thank you for listening.